After working as a doctor in the system for 20 years, our next guest shifted focus to patient advocacy.
With her wealth of knowledge and understanding, Dr. Shadi Vahdat is here today to help you help yourself. Good morning.
Good morning.
Hey.
So nice to be here with you.
Well, it's wonderful to have you in. So as Elliott alluded to a little bit, what prompted the shift from practicing medicine to addressing flaws in the system and that patient advocacy?
Well, I still practice medicine, so I haven't shifted completely. But as you know, a growing number of Americans, especially in the sandwich generation, are becoming caregivers without really having a choice. And in my case, I actually became an advocate for my father, who had really bad heart disease and all of its complications when I was a teenager. Back then, as a young immigrant, I was essentially his translator whenever he ended up in the hospital. But later, when I became a hospital physician and a functional medicine doctor, I really got to experience firsthand just how hard it was to get him the quality medical care that I thought he deserved, that I think we all deserve. The challenges and the frustrations that I faced, even as a physician, is what led to doing my TED Talk and writing the book, The Roadmap to Hospital Care.
Yeah, well, what are some of those big shocks that you came up against that, you know, and surprises that the system kind of blocks or pushes in the way, even like you said, for a doctor who knows the system?
Yeah, the biggest surprises, the most eye-opening, has been how easily and how frequently my friends and family were impacted by medical errors. And in some instances, errors that would have led to life-threatening consequences if they weren't caught in time. Just to give you a couple of examples, in one instance, a relative was given 2 medication with a dangerous interaction, and that led to a severe infection. And believe it or not, it was not picked up. That drug interaction was not picked up for an entire week during a hospitalization. Hard to believe.
Wow.
In another instance, a misdiagnosis of a cancer, multiple myeloma instead of the correct one, which is lymphoma, led to a totally different treatment and prognosis. Right. The things that have gone wrong with my friends and family, the list is really long, unfortunately, but this is exactly why I'm so passionate about these topics.
Yeah, no kidding.
Yeah, and you mentioned the book. So what really prompted you to write the book, and what is in there that can help other people?
Well, my dad's last week before he passed away in 2020 really was challenging for me. Unfortunately, despite our best efforts, he didn't put an advance directive. He didn't tell us what his wishes were, which is so important. I talk about that in one of the chapters in the book. But the hardship that we went through that last week in a hospital that didn't have his medical records is really what led and motivated me to write the book. And a lot of the book is, the first few chapters are how to prepare in advance, know your doctors, learning about hospitals, getting your records in order, and then the rest of it is just how to avoid a hospitalization if you do end up, what to do, what to look out for, and just sort of building awareness all along the way up to discharge in terms of how you can have a safer stay.
Yeah. It's really a roadmap.
Yeah, I was going to say, yeah. I mean, clearly with that in mind, obviously, you know, people need to purchase the book and get the information from there, but we have you here right now.
Yes.
Do you have any brief tips you could share with the audience at home who might be going through their own medical journey right now?
Definitely.
Anything that, you know, any kind of challenges they might be facing that you can offer some brief tips to that they should check out and be a procedure for them?
Yeah, I think the best advice that I can give to your viewers at home is a few things. Number one, be proactive about your medical care, no matter what your age. You never know when a crisis might hit, and I've had patients in their 20s and 30s unexpectedly have something happen. So be proactive about your health care. Number two, get to know your doctors, research your hospitals. There's nothing that replaces having a good team in place when challenges come up later down the road. And actually, my website has some free resources and checklists to check it out.
Perfect resource.
Yes,
thank you so much.
Thank you so much for joining us. To purchase a copy of her book or to learn more about the work she does, head to shadivahdatmd.com.